This is Bob Finn from Elsevier Global Medical News, reporting on a meeting on gastrointestinal cancer sponsored by the American Society of Clinical Oncology. A diagnosis of liver cancer, hepatocellular carcinoma, comes with a devastating prognosis. Only about 22% of patients survive for 1 year, and only about 5% survive for 5 years. But in a study comparing foreign-born versus U.S.-born patients, Dr. Vanita Ahuja discovered something odd.
And we know Asians have a worse rate for hepatocellular cancer, but no one's ever looked at what about Asians who are born here versus Asians who are born outside U.S., and especially since I was not born here, you start getting interested in this. And there's a different cause, and that's been studied, but nobody's ever looked at survival. So we looked at people who are born in U.S. versus people not born in U.S., or Asians and blacks and Hispanics and whites, what's the survival difference. We found out people actually, Asians born outside the U.S., and when they get treated in U.S., they actually do better versus Asians who are born in U.S. and got treated here.
The 5-year survival is about 3% in U.S. patients versus about 6% in foreign-born patients. Half of all U.S. patients die within 2 months of diagnosis, while foreign-born patients tend to live a full month longer. Why is this?
And the reason could be multiple, but looking at the other publications, maybe because Asians born outside U.S., they may be more aware that they have a higher risk factor for hepatitis C and hepatitis B, and they may get screened earlier.
For Elsevier Global Medical News, this is Bob Finn reporting.